Welcome to this explainer. Today, we're diving into a genuinely fascinating and honestly kind of shocking reality about how the human body works. We are going to unpack a bizarre medical mystery that flies totally under the radar for way too many people. We're talking about the hidden, sometimes wild world of benign ovarian tumors. So, we've all been there, right? You look in the mirror, or you're trying to button up your favorite pair of jeans, and you notice your stomach is just a bit more swollen than usual. The immediate, very human assumption is always, oh, I've just gained some weight in my belly, it's just a bit of fat. But what if that expanding waistline has absolutely nothing to do with what you're eating? What if something much, much larger is silently growing inside you? Well, here is our roadmap for today. 1. Understanding ovarian tumors. 2. Type 1. The teratoma. 3. Type 2, chocolate cysts. 4. The hidden dangers. And 5. Why you need screenings. Let's jump right into part 1, understanding ovarian tumors. To really get this, we have to realize just how delicate this system is. Under normal circumstances, an ovary is remarkably small. It's only about the size of the tip of your thumb. And it doesn't just sit rigidly in the body, right? It's actually suspended next to the uterus by these really thin, string-like ligaments. Think of it hanging there almost like a tiny little swing. And running right through those delicate, string-like ligaments are the vital blood vessels that deliver all the nutrients and oxygen the ovary needs to survive. So what happens when things go off track? Generally, an ovary is perfectly healthy and normal up to about 3 centimeters in size. But once it swells or grows beyond that 3-centimeter boundary, medical professionals begin referring to it as an ovarian tumor. Now, I know the word tumor sounds immediately terrifying, but let's clarify exactly what that means in this specific context. Ovarian tumors generally fall into 3 main categories. You have malignant, which is cancerous, borderline, which is kind of this gray zone, and benign, which is completely non-cancerous. For this explainer, we are entirely focused on that first category, the benign, non-cancerous tumors. These are super common, but as we're about to see, benign absolutely does not mean harmless. Which brings us to part 2, type 1, the teratoma. Remember, the ovary's primary job is to create eggs, this foundational building blocks for creating a human baby. But sometimes, the ovary gets its wires seriously crossed. In a condition called a teratoma, the ovary mistakenly begins using those building blocks all on its own, without a pregnancy. We are talking about literal masses of fat, clumps of human hair, and, get this, even fully formed teeth growing entirely on their own inside the ovary. It's wild. In fact, this phenomenon is so strikingly strange that it actually crossed over into pop culture. If you're a fan of the legendary manga creator Osamu Tezuka and his famous medical series Blackjack, you probably recognize the character Pinocchio. Well, Pinocchio's unique origin story was directly inspired by the very real, very bizarre medical anomaly of the teratoma. But here's the thing. A teratoma isn't just weird. It is mechanically dangerous. Remember that swing analogy from earlier? When a teratoma grows to about 5 or 6 centimeters, it hits this critical weight. It becomes heavy enough to cause the entire ovary to completely flip over, twisting that delicate ligament swing just like a twisted telephone cord. When that happens, which is called torsion, the blood vessels inside the ligament are pinched totally shut. Blood flow stops instantly. It causes absolutely excruciating pain, and if it's not treated with emergency surgery, the ovary will literally die and rot inside the body due to tissue necrosis. Fortunately, emergency surgery can fix this right up. And there's actually a pretty funny anecdote from the surgical recovery rooms regarding these teratomas. Doctors will often show the extracted tumor to the patient and their family, just to explain what was removed. And while female patients usually handle the site pretty well, doctors report that male partners have been known to literally faint on the spot in the post-op room upon suddenly seeing a mass of teeth and hair sitting in a medical tray. All right, moving on to part 3. Type 2, chocolate cysts. To understand this type of cyst, we actually have to look at the uterus for a second. Every month, the uterus prepares a plush, nutrient-rich lining. Think of it as a sort of baby bed in anticipation of a pregnancy. When no pregnancy occurs, that bed is shed and leaves the body as a normal menstrual period. But in this condition, which is tied to endometriosis, that baby bed lining mistakenly grows inside the ovary itself. And because it's still a uterine lining, it still responds to the monthly hormonal cycle, meaning the body experiences menstruation, but the bleeding happens internally. It gets completely trapped inside the ovary. And because that blood has absolutely nowhere to go, it just accumulates month after month after month. Over time, this trapped old blood degrades, it thickens, and it turns very dark. If a surgeon opens up one of these cysts, the fluid inside doesn't look like normal blood at all. It looks exactly like thick, dark, melted chocolate. And that is exactly why doctors gave it the very vivid, yet totally medically accurate name, chocolate cysts. So what happens next? That leads us to part 4, the hidden dangers. Unlike teratomas, which have that tendency to twist around, chocolate cysts have a completely different mechanism of failure. They tend to stick to things, and if they get too full, they rupture. When they rupture, that thick, sticky, chocolate-like fluid leaks all out into the abdominal cavity. Doctors describe the resulting surgical nightmare as being exactly like stepped-on gum. You know when you step on a piece of gum on the sidewalk and it just crushes deep into the tread of your sneaker, fusing super tight? That is literally what happens to your internal organs. They become glued together in these thick, messy, surgical adhesion. The crucial point here is the extreme danger this poses if you need surgery. When surgeons try to peel apart organs that have been glued together by a ruptured chocolate cyst, the tissues can tear. We are talking about potential damage to the bladder in the front or tearing the bowel and rectum in the back. In the absolute worst-case scenarios, the damage to these surrounding organs is so severe that patients can wake up from surgery requiring artificial urinary stomas or even an artificial anus. So yeah, the stakes of letting this go untreated are incredibly high. And that brings us to our final and most important section, Part 5, why you need screenings. 30. That is the number of centimeters these benign tumors can grow to if they're just ignored. 30 centimeters. That's the size of a large, heavy watermelon from the supermarket, just sitting inside your abdomen. At this size, the tumor completely mimics the belly of a late-stage pregnancy. And this brings us right back to that deadly trap we talked about at the very beginning of the explainer. Patients often believe, oh, I'm just getting fat in the belly. But the medical reality is their arms and legs might be perfectly thin while their abdomen is massively distended by a hidden tumor. Furthermore, people often think, well, my annual city cancer screening was clear, so I'm totally fine. But that is a really dangerous myth. Basic municipal or standard health screenings usually only check for cervical cancer and the HPV virus. They do not look at your ovaries at all. Which means you absolutely need to be your own advocate. So here is your action plan. First, never ignore localized swelling in your abdomen, especially if the rest of your body hasn't changed at all. Second, understand that basic standard cancer screenings are just not enough to catch these benign but incredibly dangerous growths. And third, and most importantly, you need to explicitly request an annual comprehensive gynecological ultrasound from your doctor. That imaging is the only definitive way to look at the ovaries and catch these tumors while they are still small and safe to manage. Which leaves us with this final, truly vital question. When was your last comprehensive gynecological ultrasound? Don't let the mystery of the human body become a medical emergency for you. Take control, ask the right questions, and book that screening. Thanks so much for joining me on this explainer, and keep learning.